my name is Kate, and I'm going to be talking about my doctoral research, which focuses on understanding the experiences of children who have life-shortening and life-threatening illnesses. We do not know as much about how children experience life as someone with a serious illness who may or will die. Most of the literature on children's experiences of having a serious illness is informed by adults, so they're bereaved parents or healthcare providers. There is a lack of research in pediatric palliative care that actually includes children as participants, which means that our policies and practices are not informed by our most important stakeholder, which is children. I've had many experiences that had me asking questions that I didn't have the answer to in my practice. So my research question is, how might we understand the experiences of children who have life-threatening and life-shortening illnesses through their artistic forms of expression? For this study, I'm using a qualitative research method called hermeneutics. I'm interviewing children between the ages of 7 and 18 years, and I'm recruiting them through Kids Cancer Care and Ronald McDonald House Charities, Alberta. In the interview, I asked children to create artwork that relates to their illness experience. By using other ways that children communicate, as a researcher, I can find a common language or a way to focus our interview conversation. Artistic forms of expression could be drawings, poems, sculptures, or anything that children create to represent their experiences. One boy responded to my question with, "Ugh, it's easier if I just draw it." He was very frustrated with trying to articulate it. So this same participant has idiopathic thrombocytopenia purpura, or ITP, which is a life-threatening blood clotting disorder, but also has periods where levels of platelets or our clotting cells are high enough to prevent significant bleeding. And between his interview dialogue and his art, he was able to talk about how he balances the times when his platelets are high and the times his platelets are low. And for him, there's a very clear distinction between times when he's healthy and when he is not. And you can see this in the comic strip that he drew. On the top, when he is good, and when his platelets are good, he said, "When I'm a good boy," but he meant when my platelets are good. He can fall and get right back up without a problem. But when his platelets are bad, even a small injury can become a serious problem, and he, quote, "falls apart." He also knows after getting medicine that increases his platelets, that he has to make the most of that time because, quote, "we only have 3 weeks when I can do whatever I want without getting hurt." So he visits every playground within 15 kilometers of his house. Another example of living between health and illness was this interview with a 17-year-old girl. She painted herself in a cage, separated from the other birds because of her sickle cell anemia. She actually had a bone marrow transplant, or BMT, to cure her sickle cell, but still needed time to catch up to the fact that she was officially healthy. I asked her if she still felt like a bird in the cage, and she replied, quote, "kind of. I don't feel like I've been let out of the cage yet. I feel like I'm stuck between having sickle cell and not having it anymore." So even when children are cured from a serious life-threatening illness, they still struggle with having had that illness, though she did put a door in the cage by the end of the interview. She had this to say about her care, quote, "My nurse was actually one of the first adults to have a bone marrow transplant for sickle cell. It was nice to have someone to relate to and get advice when I'm going through this major thing. It reassured me about my career path. I wanted to be a doctor, but having that nurse inspired me, and now I want to be a nurse practitioner." She made it very clear in her interview that nurses were not just her care providers, they were also role models who encouraged her to get through her treatment. This 7-year-old girl with cancer described the big shift from being healthy to suddenly being ill. Quote, "When I first got cancer, I was a bit scared and a bit confused. I was scared of getting pokes or needles and leukemia and taking medicine. And I thought, is this going to last forever?" Her illness experience highlighted the things that were most important to her. Her dog, who you can see at the top, her best friend in the middle, who always makes her laugh, and the hospital. She was very articulate. She really humored me doing the pictures. She did not need them, but corrected me when I said hospital and said, "Yeah, the hospital." She said, "The hospital has a lot of my friends in it, and I like learning stuff about the nurses. I found out that learning about the human body is fascinating." Her nurses and doctors became role models, and she also decided to change her career path from an aspiring fashion designer to a healthcare provider. First, to our knowledge, this is the first hermeneutic study to explore children's experiences of having a serious illness through their artistic forms of expression. I already feel that using art has been helpful for data collection, and this study might provide other opportunities to explore other ways and mediums that children communicate, like play, in future research. I'm hopeful this study will allow me to advocate for access to funding and facilities and programs in pediatric palliative care for children and support the expert nursing care that they receive in those programs. And funding from ARNET has supported my work life and school balance. And ultimately, nurses continue their education because they want to make life better for their patients. So thank you so much for being here today and for taking an interest in nursing research and education in Alberta.